Welcome, everybody. We'll get started in just a moment as we welcome more folks in from the waiting room. Thank you so much for joining us. Great to see so many familiar names and faces, folks calling in from across the great state of Arizona. Hello, Patricia. Great to see you. Wonderful. Thank you so much for joining, everybody. We'll wait just a couple more moments as we have more folks joining from the waiting room. Hello, surprise. Perfect. Well, I see our waiting room kind of slow down, and we'll continue watch chat. Thank you so much for joining, everybody. My name is David Martinez. I direct the Capacity Building and Grants Program, as well as the Civic Health Portfolio at Vitalis Health Foundation. Thank you so much for taking time on this beautiful Tuesday morning for the Vitalis Health Foundation Systems Change Grant Information Session. We are reopening our grant cycles for our new fiscal year, and kickstarted every year with this virtual information session. So thank you so much for spending some time with us this morning as we go through the logistical aspects of the systems change grant and additional information so that you can best determine alignment with Vitalis Health Foundation grant partnership opportunities. Uh, I am joined by my colleague Michelle Goodthunder, who is watching the chat room. So as you have questions throughout this slide deck, please use the chat room for the questions, and she'll do her best to answer them live in the chat room. But we will have time at the end of the slide deck to review those for the recording and to do any open live Q&A as you may have them. If you need assistance in Espanol, you can email conversemos@vitalishealth.org, and we will have bilingual staff follow up with you for a conversation. We also have closed captioning available through the Zoom services function, so you can click that if you need it. All lines we ask are muted during the webinar so we could get through the slide deck, but as I mentioned, at the end, we'll have a live Q&A opportunity so we can answer the questions that come up in the chat room and also using the raise hands function. So we'll use that at the end. Definitely ask those questions as you have them, and we will address them ongoingly. And then at the end, this recording, the materials, and those frequently asked questions that come up through that chat room and in our conversation will be shared with all the people who registered for this webinar and will be posted to the vitalishealth.org grants webpage. All right, let's get started. So as I mentioned, I'm David Martinez. I direct the Capacity Building and Grants Program and Civic Health Portfolio at Vitalis Health Foundation. On the call with me today is our Program Manager for Grants and Partnership, Michelle Goodthunder, who will be answering those questions as she can, but also does a great job behind the scenes here at Vitalis to help facilitate all of our prospective partnerships, our grant partnership opportunities, and our grants management system. And Erica Foster is our program manager for learning and evaluation. So she helps support the grants and partnership team. And once we get through the application process and select the grant partners, she is the main point of contact for our partners as part of our stewardship of our partnerships and including our learning and evaluation and reporting structures. So that's our grant partnership team. If you're not familiar with Vitalis, we're a Phoenix-based but Arizona-serving health foundation. We have a vision that all individuals and communities in Arizona are healthy and resilient, and we do that by connecting, supporting, and informing efforts that improve the health of individuals and communities in Arizona. That connect, support, and inform is really important to better understand where exactly Vitalis leverages our supports in a variety of different ways. We are a huge convener of a lot of the health issues here in Arizona, so connection is really big for us. We are a foundation, so we do leverage support both through the grant partnership opportunities that I'll review today and in many other ways through like research and communications. And we are a public foundation, and because, as you'll learn, we work in a systems change thinking, we work to inform and do a lot of advocacy and public policy on issues that are impacting Arizonans' health. While we are a health foundation, we see health as more than just health care. We look at the broader social determinants of health, or what we call the elements of a healthy community. If you might have seen this wheel, as we affectionately call it, that represents all of the variety of ways that we see a person's ability to live a healthy life. So if you're barely discovering Vitalis and learning more about how we operate as a foundation, and you're determining are we mission aligned? Is my thinking or project or effort to improve health really aligned with Vitalis and how they see health? If you see yourself in this will, you are more likely than not mission aligned, which is a great first test to see if you are indeed aligned with one of our grant partnership opportunities. You see a variety of elements of a healthy community will, but you might not see your specific area or issue, and that's okay. It might just be within one of those elements. And if you visit vitalishealth.org, we have a whole page that takes a deeper dive into the wheel. As you'll see in a slides a few slides later, we have both this will, we have this will translated into Spanish, and we worked with the Intertribal Council of Arizona, or ITCA, that represents the tribes here in Arizona, to reflect a tribal or an element of a healthy tribal community to better reflect how the will represents tribal communities and their abilities to live healthy lives. So if you're first asking yourself, am I mission aligned with Vitalis and our grant partnership opportunities? This is a great first test. Our Systems Change Grants program is been evolving over the past decade or so. We, as a foundation, want to tackle the root causes of the greatest health disparities in Arizona, and we want to support efforts that are doing that. So we have framed our grant partnership opportunities to support collaboratives in their journey towards systems change. That's a really big framing and also question to begin to ask yourself if you are indeed aligned with Vitalist, because we follow what is often called a more upstream intervention to improving health rather than a downstream intervention. Both interventions are really important, but as a foundation, we're leveraging our grant funding opportunities to support those upstream interventions, which tackle, again, the root causes of Arizona's greatest health disparities through policy, systems, and environmental changes. That is different than a downstream intervention, which is a bit more programmatic or direct service. So if you are an effort that is doing great work with serving Arizonans, providing that direct service, we really thank you for your work, but there's already a misalignment because Vitalist grant partnership opportunities support that collaborative working towards systems change. We do so through a three-tiered grants program, which I'm happy to say has been increased for the first time in several years by the Board of Trustees at Vitalis Health Foundation. So in total, the Systems Change Grant Program at Vitalis is a 5-year grant potential for up to $230,000. It is broken up into 3 tiers, though, depending on where your collaborative is at in their journey towards systems change. So if you're at the very beginning of your journey towards systems change, you might be best qualified for the Technical Assistance Grant, which is meant to be a up to 1-year grant of up to $20,000 to support collaborative capacity building for those collaboratives who eventually want to plan and implement systems change. So if you're barely at the beginning of your efforts towards system change and you're building up the capacity of your collaborative, you're identifying those collaborative partners in the right roles, building up the infrastructure, the trust, the governance that is needed for a strong collaborative, that would be the technical assistance grants. Then we have the second tier, which is our Spark grant, which is a 1-year grant of now $30,000 that is meant for those collaboratives that have built their capacity. Now they're ready to go into the planning phase of their systems change. So the Spark grant is more of like a planning grant. And then hopefully once the collaborative has built up their capacity, they've done their planning, then they're ready to implement their systems change effort. And that is the systems change grant, which is the 3-year grant of now up to $180,000 for the total 3-year grant cycle. So that is the grant that we'll take a deeper dive in today because each of these grant cycles are on a different, excuse me, each of these grant types are on a different grant cycle, which we'll review in a few slides as well. All of these grant partnership opportunities can be explored through what we call our discovery process. This is the process that we began to help facilitate those conversations to explore if your effort is indeed aligned with Vitalis grant partnership opportunities. We recognize that our grant partnership is really unique in that it is supporting system change efforts and not programmatic or direct service work, but that might be hard to see for a lot of folks. So we use the discovery process to have these initial conversations to determine if there is indeed alignment, and then if there is alignment with one of our grant types, then facilitate that conversation and the application process moving forward. The discovery process is really important because if you are interested in the technical assistance grant and the Spark grant, you have to go through the discovery intake process to determine alignment and then be invited to submit an application for either one of those two grants. The discovery process is not required for the systems change grant. However, we highly, highly, highly encourage all prospective partners to go through the discovery intake process for the systems change grant to determine if there is alignment, and if there is alignment so that we can give feedback to make your proposal as strong as possible so that once you submit it through our online portal, it is, again, as strong as possible. We, of course, can't write the proposal for you, but we want to have those initial conversations with you through our discovery intake process to best determine alignment, and if there is alignment, to help make your proposal as strong as possible by providing feedback before the deadline. As I mentioned, the discovery intake form is that initial process to explore partnership with Vitalist. And if you can go to vitalishealth.org, our Partnering with Vitalist webpage, to complete that discovery intake form. It is not the official grant application. It is simply an interest form or a letter of inquiry to determine if there is alignment. So as you're going through this webinar, doing your own research on the vitalishealth.org website, reviewing our criteria for each of our 3 grant types, and you see there might be a potential alignment, then complete that discovery intake form. We'll receive it, review it, and if there is alignment, you'll receive a prompt to schedule a time to chat with one of the Vitalist Health Foundation directors that you see here on the slide. Who you have a conversation with depends on what your project area is. So each of the 4 directors at Vitalist oversees a different portfolio of work and has a different expertise and background that they're bringing to Vitalist. So my colleague Gabriel Jaramillo, who you see there, directs our Healthy Communities portfolio, which includes our efforts around housing, the transportation, the built environment. So he facilitates a lot of those efforts for projects that are in those arenas. I am a more generalist here at Vitalis Health Foundation, so have conversations that fall outside of my colleagues' expertise as well. My colleague Sergio Perez directs our strategic communications, but he has experience and backgrounds both in educational systems and food systems, so facilitates conversations in those spaces. And then my colleague Anna Brosetti directs our state health policy and advocacy, including our healthcare integration portfolio. So she facilitates a lot of the healthcare specific efforts and also broader public health or integration with social determinants of health efforts as well. So these are the folks, as you're going through discovery intake form, you'll have initial 30-minute virtual conversations with to begin to explore alignment, and then they'll help facilitate the process moving forward with the help of our colleague, Michelle Goodthunder. So now let's get into the actual grants themselves. So as I mentioned, the Vitalist Grants Program is a 3-tier grants program designed to support collaboratives in their journey towards systems change. Which grant you qualify for or might be aligned with depends again on where you're at in your journey towards systems change. Again, if you're at the beginning of your journey, building up the capacity of your collaborative, that would be the technical assistance grants. If you're at the planning phase, so you've built up the capacity of your collaborative, now you're ready to do the planning, strategic planning, really thinking through the specific interventions or solutions towards systems change, you would be in the Spark grant tier. If you're at your implementation phase, that would be the system change grant, which we'll review in depth today. The system change grant is, before I get to that, you do not have to start at square one. So if you're ready to plan, you can complete the discovery intake form and go to and select interest in the Spark grant. And then if there is alignment, we'll facilitate that process for you. If you're ready to implement, perfect. You're in the right place because we're going to take a deeper dive into the systems change grant. And again, if you're at the very beginning of your journey, you would qualify for the technical assistance grant. So you don't have to start at square one with the technical assistance grant. You could jump to the second tier or the third tier, depending on, again, where you're at in your journey towards systems change. So the system change grant is a grant that will take a deeper dive in for this specific webinar because this is the grant cycle. All grant cycles are now open. The discovery process is open, so you can complete that intake form as you see alignment and then facilitate the conversation. We specifically focus on the system change grant because it is our larger of the three grant types. It's a 3-year grant award now for $180,000. It's a very competitive grant process because as you see, for this fiscal year, we have 4 system change grants to award. Typically, we receive anywhere from 40 to 80 initial applications to give you a sense of the competitiveness of this grant process. We also review specifically the details of the systems change grant through this webinar because it is an annual grant cycle. It is open now. You can complete a discovery intake form. The portal for application submissions is open, and the applications will be due October 29th. So we take a deeper dive into this because it's an annual grant cycle, as opposed to the Spark grant, which is quarterly. We'll have a fall, winter, and spring cycle, and then the technical assistance grants are reviewed on a rolling basis and do not have deadlines. We'll take a deeper dive into those two in just a little bit. So as I mentioned, the grant cycle for the systems change grant is now open. Our online portal is opening today through our grants management system called Akoya Go. You'll receive the link and the materials, and it'll be posted to our website shortly. As I mentioned, we highly encourage folks that are interested in the systems change grant to go through that discovery intake process, which again, Michelle has linked in the chat room and is available at vitalisthealth.org on our Partnering with Vitalist webpage. Again, it's not required, but highly encouraged because we really do want to work with you to determine alignment with all of the grant criteria. And if there is alignment, to make your proposal as strong as possible, for providing, as we can, feedback to your draft proposal. In order to have those discovery consultation calls, we require that the discovery intake form for the systems change grant be completed by August 16th so that we could have that initial conversation with you before the October 29th deadline for system change grant applications. So all of the systems change grant applications are due October 29th. But if you do want to have that initial conversation with a Vitalist director, you have to complete the discovery intake form by October 16th. I think you can understand that we want to provide you enough time to have that conversation and then compile the proposal if there is alignment. So once we get past the deadline of October 29th, we then go into an initial review of all the applications. We have an internal team made up of Vitalist staff members that read all of the initial applications and determine baseline eligibility based on the criteria points that we'll review today. So we'll review all of the applications, see which ones meet the baseline applications, and then those that do are advanced to a full review or a review by our full team throughout the month of November through December 1st, as you see there. So there's a first kind of review to meet baseline requirements of the criteria, and then those that do are advanced for full team reviews. After our full team, which now includes members of the Vitalist Board of Trustees, we have a grants committee of our board that participates in the reviews at this stage of the written applications. Once those reviews are done, we use an evaluation rubric that will be shared and posted to our website. We call this an open book test, so you know exactly the questions that our reviewers are assessing as they're reviewing your applications. And so you can really look at how you can make your proposal as strong as possible based on the criterias. So all of our reviewers use that rubric to submit their scores. We compile those scores, and then staff have a conversation to determine which of those to advance and invite to present their proposals, which happens in the month of January. After this stage, if you are not invited to present your application, you will receive a declination notification and then have an opportunity for staff to provide feedback on why it was declined later on in the calendar. Once folks are invited to present, those semifinalists are schedule a time to chat with a Vitalist team member so that they can provide feedback based on the written application so that you can then address that feedback, any questions that our reviewers had on your written application during your presentation. And then you will also be prompted to schedule a time to schedule that 45-minute proposal during the week of January 11th through 15th. That is a virtual presentation, again, 45 minutes via Zoom, where your collaborative will have the opportunity to present your proposal to the Vitalist Grant Review Team, which again includes members of our Board of Trustees. The proposals will be done virtually, and during that proposal feedback session, more information will be provided based on the proposal. We do this two-step application process, both the written application and the presentation of your proposal, as a means to practice an equitable grant making. Oftentimes, Vitalist works with and is very open with and highly encourages grassroots community-based organizations to discover partnership with Vitalist and apply for our grant partnership opportunities. We don't just work with large institutional partners, and often those large institutional partners have development officers, grant writers, fundraisers whose written application might be really strong, whereas a grassroots community-based organization might not have a development officer or a fundraiser or grant writer. So their written application might be strong enough to be invited to present their proposal, but they are much more better at telling their story in that way. So we try to level the playing field, if you will, and have an equitable grant making program by having both the written application and the oral presentation as noted. So once all the presentations are completed by those semifinalists, our grant review team conducts a separate evaluation of the presentation using a separate evaluation rubric that again will be shared. It's an open book test, so you know exactly what you should be covering during your presentation, and then what the reviewers are assessing that presentation against. We'll compile those scores, match them with the scores from the written application, and then from there, staff makes a formal recommendation to our board grant committee on which for to award funding for. Our grant committee of the board reviews the recommendation, the feedback from both the written and presentation aspects of the process, and then asks questions of staff and accepts or revises their recommendation for the four, and then their ultimate decision advances to our full board for ratification of that recommendation. That happens on March 25th. And then as soon as that board says thumbs up, we approve these four system change grant partners, we send the award notifications, and in those that aren't selected, declinations as well. So we understand this is a very long timeline for our grant cycle, but know that we have worked over the last several years to cut it as much as possible and to make it as seamless possible a seamless process as possible, reflecting both the written application, the presentations, and then our engagement with the board and ultimate board approval. So now that we've reviewed the timeline, let's begin to get into the criteria. For folks that are familiar with Vitalist, these aren't very much different, but what we have done is worked internally over the past several years to try to help folks better understand what exactly we mean by each of the criteria. You'll also see that there are now 4 criteria because we have embedded the equity lens that we had previously had as a criteria within each aspect of this criteria, which you'll be able to see more in-depthly as we go criteria by criteria. So the 4 criteria for the systems change grant is it has to be a systems change effort. These grants are framed to support systems change interventions rather than those downstream interventions I mean. So if you are conducting important work that's programmatic and direct service, that is misaligned as a systems change project. So these are efforts that are tackling the root causes of the greatest health disparities in Arizona. Again, we'll take a deeper dive into each of these criteria. This is a big aspect of the grants, which is why the total points available is the most as we score them. System change work is hard work, it's heavy work, it takes a lot of time, and it takes a village, which is why we have a strong emphasis on the collaborative criteria as well. So in this system change grants, your collaborative should have built your capacity, should have identified the right partners in the right roles, built up that infrastructure, the trust, the governance needed to effectively plan and then implement the system change. So your collaborative should be very strong at this point and ready to implement the system change efforts. Again, a really important aspect of the criteria, which is why it has a higher percentage of the total points available. The efforts have to work to improve a specific health outcome here in Arizona. We are a health foundation. We want to improve health, as you saw in our vision and mission. And again, we look at the elements of a healthy community's wheel to help frame what those particular and specific health outcomes are. At this point of the of your journey towards system change, you should have a very specific data-driven effort to improve health outcomes. And finally, the criteria around the budget. In your proposal, you have the opportunity to provide a budget narrative to better clarify how you intend on utilizing the grant funding available from Vitalist and what your overall financial capacity and anticipated budget is for your overall systems change effort. There is also a separate budget spreadsheet where you clarify line by line what the specific expenses are and how you anticipate leveraging the $180,000 over 3 years. So these are the 4 grant criteria of the systems change grant, and each of these have specific questions that are reflected in our evaluation rubric. So so long as you answer those specific questions that are noted here, you will have a strong proposal. So now we're going to go criteria by criteria to take a deeper dive into what we mean by each of these grant types. So first, as I mentioned, these system change grants are called system change grants because we want you to focus your efforts on a systems change project. These 5 questions noted here, again, are the same 5 questions that our evaluation rubric notes. And the descriptor under each question is the ranking that is the strongest possible outcome. So for the first question for the system change project criteria is, what system are you trying to change and what problem within that system are you addressing? So you have to be thinking in this in systems, a system thinking approach. So what is the system you're trying to change? This again could be is tied to the elements of a healthy community will. So for instance, if you are trying to address the outcome of the health outcome around food insecurity and hunger, that would be the food system. Or if you're trying to impact some aspect of schools, that would be the educational system. And then what is the specific problem within that system that you're hoping to try to address? So in those examples, right, food insecurity, and within the food system. And then to answer to the strongest possible to answer to the strongest possible scores possible, you would clarify that this work is at a systems level, the problems to be addressed are systemic, the barriers holding the problem in place within the system are clearly identified. Similarly, if you go down for the second question, what will be your approach over the 3-year grant period to make progress towards systems change? Please include specific strategies. Again, this is the implementation grant, so you should have already done your capacity building, you should have already done your planning, you're ready to implement. So this is where you really begin to clarify what exactly is your project that you hope to advance towards systems change over the 3-year grant period, and what are those specific strategies. So really, your approach should be directly targeting root causes and using strategies known to support systems change and aims for the long-term impact. The third question here, what's the success look like if you achieve your system change goal? This is our evaluation metric. What is your measure of success? We know that systems change in totality is a complex and comprehensive effort, but in this grant period, what do you hope to achieve and advance as part of your systems change? And then similarly, you can look at the fourth question here, what has changed recently, which makes this work possible now? This is a really important aspect of it because we know that change happens within systems change efforts, and there might be a specific policy window or leadership change or funding shift or greater awareness, public awareness that changes the ability for systems change to happen at certain times. So why is now the best time for the systems change to happen? And then, as I mentioned, change happens within systems change. So we want you to be able to anticipate what barriers your collaborative might experience in this and how you'll address them, learn, and pivot as needed. So this is the specific questions that our grant reviewers will assess as part of the systems change project design criteria. To help you better understand what we mean by systems change, because this again is the criteria that more often than not is where folks are misaligned, which is why we highly encourage, again, you to go through the discovery intake process, even though you technically don't have to, for the systems change grant, so that we could work with you to help better understand if your effort is indeed a systems change grant. We have on our vitalisthealth.org website a whole slew of resources, including this Spark report, which we drafted a couple years ago, that helps folks better understand what we mean by systems change, which is this set of interconnected, interdependent, and interacting parts that form a complex, unified whole. That is the system. So in our world, there are a lot of different systems like our galaxy, the Milky Way, the solar system, but even back down on Earth, even the simple concept of like a bicycle is a system. Because if you imagine a bike, there are a lot of different interconnected, interdependent, and interacting parts like the handlebars, the seats, the chain, the wheels, but together they form a very complex unified whole that form the bike, right? So that's the system. The systems change is an effort that's needed because a condition needs to be shifted that's holding a problem in place. This often for us is a problem that is impacting the greatest disparities in health. So that's where we begin to shift from broader systems thinking to what that systems change actually is. That systems change can look like a lot of different things. We have used this visual that reflects 6 conditions of systems change to help folks better understand the different conditions of systems change that are possible. In big picture transformative systems change, all 6 conditions are met, but we know that that takes several decades, several years, several amount of resources, several partners and collaborative efforts to help achieve that transformative, all 6 conditions of systems change. That obviously is way more than what can be done with the Vitalist grant partnership opportunities, even if you get all 5-year grant potential with the 3-tiered grants. Certainly, it's a lot to tackle with just the 1 year, or excuse me, the systems change grant, which is the 3 years. We know that the transformative, big picture, North Star, big, hairy, audacious goals that we really want groups to work towards go far beyond what Vitalist grant partnership opportunities have. So what we highly encourage is for you to think through, okay, what one or two of these conditions are we going to prioritize and tackle utilizing these Vitalist grant funding opportunities? So again, you don't have to tackle all six with Vitalist grants. Really think through what your collaborative, what is that condition that we can influence and change utilizing the systems change funding that we have available at Vitalist. So you'll see here the six different conditions. This top layer here are the structural changes. These are the most explicit or the most easiest conditions to see. This is where we often work and often find strong alignment because these are the easiest conditions to see again. If you look at policies and practices, these are like policies. This is like if you're trying to change the policy, the law, proposing legislation. Working with the state capital or maybe even at the local level to implement a city ordinance or something like that. So the policy is like vote yes on House Bill 1. That's a real tangible condition that you can see as a systems change, very, very explicit. Similarly, for practices, there might be some practice that you need to change at an institution or regulatory practice at a state agency or city department. That's a little bit more tangible to see. Similarly, for resource flows, we see this a lot when we work with Access, our state Medicaid system, to try to change reimbursements opportunities for groups like that. That resource flow is a little bit easier to see. It's when you get to these middle tier and this bottom tier where it becomes a bit more implicit. So this relational change level, relationships and connections, power dynamics, those are conditions that need to change in order to impact the most transformative systems change efforts, but are a little bit more difficult to see, right? When you're shifting power dynamics, it's not as tangible. You might see it big picture with like power shifts and like community empowerment, empowering the voices of families to advocate for their children, say, or building these relationships and connections. It's a little bit more difficult to see, a little bit more soft, but still a condition of systems change. And then the most difficult to see and track and measure is a mental model shift. This is where you're changing hearts and minds. Again, this is most transformative and the most difficult because it takes several years to do this. If you think of an example where a very comprehensive transformative systems change that has met all six conditions, I often refer to the concept of mothers against drunk driving, right? They identified an issue several decades ago that their children, their family members were dying in car accidents by drunk drivers. That was the problem they were trying to address. They then came up with this very comprehensive campaign to change policies, right? To have law enforcement get more strict around and prohibit drunk driving, change practices that happen at law enforcement with like breathalyzers and all of that stuff. Certainly change resource flows to get more funding to support those efforts, change power dynamics, build relationships, and then again, change hearts and minds so that folks that are partaking in a beverage or two use rideshare or have a designated driver, again, changing hearts and minds to tackle that problem. So that is an effort, as we know, took several decades, still a lot of work to do because we know that drunk driving still happens, unfortunately, but that effort is continuously to evolve. So again, you don't have to tackle all six conditions. Look at which one or two that your collaborative can actually have influence over during the period of our grant cycle. Here's a deeper dive into those tiers. You'll see the structural change, the most explicit policies, practices, and resource flows, and then specific examples that you can begin to think through, okay, what is my intervention or solution that our collaborative has planned for, and how does it fall within one of these conditions? Similarly, for the relational changes of relationships and connections and power dynamics, and then again, that most implicit, the transformative change of mental models. So here it's just a little bit more deeper dive into what each of those conditions include as you're thinking through, okay, we know what the problem is, here's what our solutions could be, and here's how they could be framed as a systems change or not. As I mentioned, When we're talking about systems change, we often talk about it as an upstream intervention rather than a downstream intervention. So here's another visual that we use that shows that an upstream intervention is much more of a population-driven or community-driven impact that improve community conditions through tactics that often turn to laws, policies, regulations, different conditions of systems change there, right? And then as you get down this stream, you move more into individual impact, where you end up all the way downstream, where you are doing more direct service, programmatic work, and there are more specific, in this case, medical interventions. So it's this downstream and this midstream that is not generally aligned with the systems change effort. We want to focus on upstream interventions. Systems change work is really complex, and folks often are kind of confused about what exactly, if their effort is exactly a system change or not. So here's the difference between systems change and programmatic work. So as I mentioned, a systems approach is heavy work. It takes a village. That collaborative aspect of it is really important. That collaborative should be unified in their effort to implement the goals and the strategies that they have developed, and each partner plays a specific role. That's a really important aspect that we'll take a deeper dive into on the collaborative criteria. It's the right person, the right partner, and the right role as part of your collaborative. You should be focused on, again, those root causes, the upstream interventions, not just the symptoms, which are more downstream interventions. Your systems change effort should definitely include those community members with lived experiences. We often say those closest to the problem should be closest to the solution. And this shared leadership model with engaging community is important as you're building up your collaborative and identifying those solutions that are core to your work. And then, as I mentioned, system change work takes a long time. It's non-linear. It's more like a bowl of spaghetti, and your collaborative has to be ready to learn and pivot as change happens within systems change efforts. So those are aspects of systems change that we often see. On the right side, these are aspects that system change does not include. So again, if you're only addressing the symptoms of social change, those more downstream interventions, very important to address those, but our grant program focuses on the systems approach. So you see examples like this, so simply subsidizing healthcare costs or distributing food boxes. Again, very important work. We don't demonize the downstream or programmatic work. Our grant program is just focused on that upstream intervention. So if you're just delivering programs, and if you're just a singular organization that's doing so, it's not systems change and is not aligned with Vitalist grant opportunities. Oftentimes, programmatic work is focused on outputs rather than outcomes, which is often another question to consider if you're determining if your effort is indeed systems change or programmatic. So to help you better understand and see what has been a successful system change grant that Vitalist has awarded, we have done a lot of work over the past couple years to showcase who are our existing system change grant partners. These are from last year, and we have a new class that we'll have new videos for over the next couple months. So if you go to the vitalisthealth.org news webpage, our social media, you'll begin to you can check out these videos so you can better understand what were successful system change grant partners. What I love about these videos and how we frame them is we really try to hit on the criteria aspects that made these system change grant partners successful. Definitely check those out to better understand who has been successful, and you can see the variety of different health outcomes that we have been able to support. Again, looking at the will, the elements of a healthy community will. So for this class, we're supporting efforts around food systems on tribal communities, maternal and children health, sexual abuse and trafficking, especially in northern Arizona, and a resource sharing system that are supporting nonprofits in Arizona. Really amazing efforts that are changing the systems here in Arizona. So that reviewed the criteria around systems change, the first criteria. Now we're going to take a deeper dive into the second criteria of collaborative. So in your proposal, you have the opportunity to provide a narrative on your system change project design. You have the opportunity to provide a narrative on your collaborative, which it should be reflective of these four questions here. And in addition, you will upload letters of commitment from your core partners as part of your collaborative. So this is a really important aspect because you will submit your written proposal, which is a narrative piece, but your partners can should be submitting a letter of commitment noting their specific roles and responsibilities as part of your collaborative. This is really important because while October 29th, which is the deadline for the system change grant, seems far off, it's really not. And partners need time to draft their letters, sometimes have it approved by their higher ups. If you're working, especially in an institution like a university or college, like a government institution, like a tribal government entity, generally that process takes longer. So as you're thinking about alignment with systems change grant, you should be asking your core partners to begin working to get their letters of commitment approved so that you can submit it as part of your grant application by October 29th. So as part of your collaborative narrative, you should answer these four questions, which again are on our evaluation rubric. And then the descriptor is what we're using to assess the strongest possible application. So the first question for collaborative is, who are the collaborative partners? What roles do they play? And how is this reflected in the letters of commitment? So in this instance, your collaborative must be at least 3 Arizona serving partners, each with a clear role in the systems change effort, and they should each submit a letter of commitment that is reflecting their efforts, their roles, and how their work aligns with the overall collaborative. A couple of things I want to clarify here is at minimum, you should have 3 partners as part of your collaborative. We really are looking for quality over quantity, and you'll see uh, uh, that's really what we're looking for. We're not looking for a million partners that you're listing that are maybe tangentially engage in your process. Really, who are those core partners that are helping you take specific actions towards your advancement in systems change? The partners have to be Arizona serving. So you do not have to be an Arizona-based nonprofit. You can be a national group or an entity that is based out of Arizona, but the work has to be serving Arizona. An Arizona nonprofit, a nonprofit or an Arizona government institution can apply. Fiscally sponsored projects can also apply, but the effort has to be Arizona serving. The second question there is, what is the history and structure of your collaborative, and why are the current partners well positioned and ready to lead this effort? Again, this goes through the system change grant is the implementation phase. So you should have already built the capacity of your collaborative. You should have already done your planning. So if you still need to do more about that infrastructure and building up, you might not be ready for the system change grant. The collaborative has the right partners, a clear structure, and a shared understanding of roles and goals. The third question here, are there any key partners or organizations not yet included who are critical to success? If so, why are they missing and what is your plan to engage them? This is a really key aspect of it because again, the capacity build or the technical assistance grant and the Spark grant are meant to provide you with time and resources to do that so that by the time you get to the systems change grant level, you're just ready to go. You're ready to implement. You're not adding any additional partners. You might evolve and pivot as needed, but your key partners or organizations should be included at this point. And if they're not yet, then you have to explain why and what is the plan to engage them. And then lastly, the fourth question here under the collaborative criteria is, how is the impacted community represented in the collaborative and involved in developing the proposed systems change? This is again how we are infusing the health equity criteria within and embedded each of the other criteria. So it is still a very important aspect for Vitalist. It is a value of Vitalist, and this is how it is reflected in the collaborative. So are those closest to the problem, closest to the solution, and have a specific role as part of your collaborative? So we reviewed the systems change criteria, the collaborative criteria. The third criteria now is the effort has to be improving an aspect of an element of a healthy community. So what does this look like? The first question here, what health outcomes does your collaborative hope to achieve, and how do they connect to an element of a healthy community? So at this point, you should have a specific health outcome. It's very clear and is reflected within the will. The second question here, how will the proposed systems change improve these health outcomes, including for communities experiencing disparities? Please include cited data. This is again how we're infusing the health equity criteria and embedding it within all of the criteria aspects. So for this instance, we want you to use as disaggregated data as possible to show that that your system change effort is impacting a specific health outcome. So for instance, if you are broadly working to improve the diabetes rates in Arizona, that would be too broad. We want you to focus on, okay, based on the data that we have that's cited, that's trusted, here are the communities and populations that have the greatest health disparities, the worst diabetes rates in this instance. So we know based on data that Black and African American communities face the greatest then the worst diabetes rates here in Arizona. So your efforts should be framed in that way. The third question under the health outcome criteria is how will progress in achieving the desired outcome be evaluated, and what metrics are used to gauge improved outcomes? This is a really important way that we work with the partners to measure your success. You do not have to have formal evaluation as part of your grant application, but we do want you to be able to track that you are making improvements as part of your interventions and solutions or systems change to improve health outcomes. We know again that change happens within system change efforts, so your outcomes might not be like solving the diabetes inequities in Arizona, but smaller steps towards that overall system change efforts and progress or advancement towards system change. In past, we have seen this we have seen it in a lot of different ways. So for instance, we had a grant partner that was working to repeal a state law. That was their overall goal. But in order to repeal the state law, they had to set up a hearing, get permission by the committee chairperson to have that hearing, present at the hearing, get approval of that committee, and then go to the chamber and then switch chambers and do it all over again so that the bill can be passed through our bicameral legislation. A lot of baby steps to their overall ambition of repealing a state law, right? But they tracked and measured each of those baby steps and were ultimately successful. So those are the three questions for the elements of a healthy community outcome criteria. Again, here is the visuals of the will to give you a perspective of how you find alignment with your health outcomes and how you'll frame this. You can certainly use the elements of a healthy community will that I reviewed. I noted we have translated that to Spanish. We accept the Spanish language discovery conversations in order to best meet the needs of communities, and they can reflect their efforts using the will that's in Spanish. And then again, we worked with tribal communities to create the elements of a healthy tribal community. So if you're doing efforts on tribal lands, you can reflect your health outcome improvements using the tribal will. It's also just really pretty. And if you go to vitalisthealth.org, the will webpage, each of these wills have more in-depth descriptors of each of the spokes and are more interactive as well. So you can identify the specific activities and health outcomes for each of the elements. This is also a visual that we use to show that health is more than just health care. In fact, 80% of health outcomes are non-medical factors. So this is, again, the social determinants or social indicators of health, or what we call the elements of a healthy community will. So you'll see 40% of health outcomes are dependent on socioeconomic factors like education, job status, income. The next highest is health behaviors at 30%. So if you use tobacco, if you don't diet or exercise, if you use alcohol, or then those impact your health outcomes as well. Healthcare is a critical aspect of being able to live a healthy life. So we can engage in efforts that engage access to care and the quality of care. And then the physical environment is a big aspect as well. Our ability to live in healthy communities, have healthy, clean air, clean water, etc. So it's a variety of health outcomes that can be tackled. We just don't focus on health care. Finally, the fourth of our four criteria. As noted with the system change criteria, the collaborative criteria, and the health outcome criteria, each of those, you have the opportunity in your written application to write a narrative on how you on answering each of these questions for each of the three criteria. So, or each of the four criteria. So in this instance, for the budget narrative, you'll work to answer these three questions. In addition to that narrative in your proposal, you will upload a budget spreadsheet, which we will provide that budget template so you can outline what your specific expenses are over the 3-year grant period and what your overall anticipated systems change budget is like. But for the narrative, you answer these three questions. And again, that descriptor is what our reviewers are assessing as the strongest possible answer. So in this first question for the budget, what are the projected costs the grant will cover, and how are these linked to your strategies? How is this shown in the budget spreadsheet? We want to make sure that the proposed budget is consistent with the proposed scope of work. So really, how do the requested amount aligns with the strategies that are helping you achieve the work? Is it justified, and is it easy to understand? The second question is, what is the full financial picture for the system change effort, including total anticipated cost and any additional funding sources or commitments needed for this work? As I mentioned, systems change, even just tackling one condition or two conditions, is a lot of work. It takes a lot of time, a lot of partners, a lot of resources. Even we recognize far beyond what Vitalist grant partnership opportunities are. So we want you to be thinking about that big systems change potential, but also recognize that Vitalist grants is just one piece of the puzzle to that overall financial picture. So really, does the collaborative see the big picture for the systems change potential, and what additional funding sources or commitments are clearly identified? This does not mean you have to have matching grant commitments. We do not require matching for this, but we want you to be able to see the big picture and recognize that it more often than not involves way more than what Vitalist grant funding provides. And then finally, how does the budget compensate partners and community members for their role in the system change efforts? This is again one way that we are holding the equity lens in the budget. As you're developing your budget with your collaborative, it really is up to you all on what that diversification of budget expenses are. But we really do want you to respect the time and the commitment of your partners, including those members with lived experiences. So how is that justified and or distributed in a way that reflects each partner's roles? So that are the three questions for the budget criteria. We do have a couple of allowable and not allowable expenses for the budget. We are pretty open with allowable expenses, and as you see the budget template, you'll begin to see more of those categories. But here are things that we specifically wanted to highlight. For allowable expenses, you can leverage the grant for for-profit entities, but we would like to have a discovery consultation call with you to really review what those expenses could be. So this could look like a lot of different things. In many instances, it might engage with local consultants or coaches that are helping facilitate the process, or for-profit entities that are critical to help you advance whatever your system changes, especially if they might have a specific influence to help drive that intervention. We do allow direct or grassroots lobbying. We are a public foundation, so we, like other 501(c)(3)s, can engage in direct and grassroots lobbying. And this is where you are advocating for a specific piece of legislation or practice or regulation. So you would say, vote yes on House Bill 1 or vote no on City Ordinance number 3. This does not include the broader advocacy space of education and raising awareness. Those aspects of it, those are all allowed. This is specifically around direct or grassroots lobbying. We do have to review this with you though, because as we provide grants to efforts that are engaging in direct or grassroots lobbying, we have to work very closely with that partner to track those expenses as part of our own lobbying reports, because we do have a threshold and limitations that we have to follow by IRS to maintain our 501(c)(3) status. So it's allowable, but we have to review in order to ensure that it's on the up and up and we are able to track that with you. What is not allowable to be funded using the Vitalist grants? We do not do capital, so we do not support buildings. You won't see the Vitalist name on any pretty building around town because we don't invest in capital. We do not allow funding for our grants for long-term assets. This is more often seen as like equipment, sometimes like computers or office materials or vehicles, things like that. Um, there might be some expenses that are needed in order to help implement your systems change as part of your collaborative. And we're happy to review what those assets are that you want to be included funding. And that's why the discovery call is so important. We do not allow university indirects to be included within the Vitalist grant opportunity. So if you are the lead applicant as a university or college, it's incumbent upon you to work with your institution to determine which department is best suited that would allow you to submit an application without including university indirect. We have existing university and college partners that work with their institution to determine which entity makes most sense for their grant to go through. Oftentimes, it might be your foundation office, your sponsored projects office, or sometimes even the Arizona Board of Regents if you are at the university level. And then we do not allow funding for ballot measures. So while ballot measures are systems change approaches, we have a public policy committee of our board that reviews Vitalist stances on ballot measures and go through that public policy review process to then determine if Vitalist does endorse or oppose certain ballot measures, and at that point determine if we want to leverage funding for that effort or not. The reason why we do not allow ballot measures to be supported with the systems change grant, even though again it is a systems change, is because we have to go through that vetting process. And if Vitalis provides funding for that support, that means we oppose or support that effort as well. And we want to be able to go through that vetting process and then determine at that point what, if any, funding we leverage as a foundation to support that specific ballot measure. So just as a recap, these are the 4 grant criteria of the Vitalist System Change Grant. It has to be a systems change project led by a collaborative to improve a specific health outcome and a budget that is consistent with the proposed scope of work. Here you see again the breakdown of points based on that evaluation rubric. So you can see there is weight on certain criteria that is of importance. So after reviewing all of that criteria and you're like feeling really good, you're like, I think we are aligned and you're already working on completing your discovery intake form. Here are the next steps. You've already seen the timeline here. We really highly encourage you to complete the discovery intake process, which again, you can do at the vitalisthealth.org, partnering with Vitalis webpage. If you are seeing alignment with the system change grant, you would just select interest in the system change grant selection. You have the opportunity to provide a high-level overview of your project, your collaboration, and whatnot. Again, this is not the formal grant application. This is simply a letter of inquiry, a letter of interest that helps begin to facilitate the process. If you do go through the discovery process, which again, we highly encourage you to do that, it has to be completed by August 16th so that we could get through those initial consultation calls, allow you a good amount of time to compile your proposal so that you can submit it by the deadline, which is Thursday, October 29th by 5 p.m. Mountain Standard Time, Arizona. Through our online portal that's linked there, we have a grants management system called Akoya Go. In that online portal, there are fields for each grant criterion. So all the four grants have a separate field. So it's not just uploading one big document. Each field does have a different character limit based on the percent, the score rate, weight, excuse me. So systems change project design has the highest percentage points possible. So that character field is bigger than the others. But in total, as you're drafting it, maybe in a Word doc or whatnot, it is about 4 to 5 pages, all said and done when you have each of the four fields compiled together. But when you're in the application portal, you will um, you will submit the narrative for each criteria separately. You just won't upload one document. If you have any questions throughout this process, we have an open door policy. Please email grants@vitalishealth.org with questions and we can get them addressed. So as you're going through this webinar and you're thinking, I'm not quite sure we're ready for this implementation phase. We might not have an application ready for the October 29th deadline. We might be earlier in our stages in our journey towards systems change. So what are the other grant partnership opportunities? Here they are. So as I reviewed earlier, we have the three-tier grants program. We reviewed the systems change grant. The tier below that is the Spark grant. This is the planning grants phase. It's a one-year grant of now $30,000. For the Spark grant, you have to go through the discovery intake process to determine alignment with the director. And then if there is alignment, they will invite you to submit an application. Because you have to go through the discovery intake process, it's really important to note the discovery deadlines. So as I mentioned, we have quarterly Spark grant cycles. The next one is in the fall. In order to be considered and invited to the Spark grant for the fall, you have to have completed your discovery by September 25th, and if aligned, invited to submit your proposal by October 8th. Similarly, for the winter cycle, you have had to completed your discovery process by January 22nd to then be considered to be invited to submit your proposal by February 4th. And then lastly, for this fiscal year, if you want to explore for the spring cycle, that discovery has to be completed by April 23rd and your proposal due by May 6th. And then once the proposals are due, then we go through our review process and which includes the board, a board consideration and ultimate ratification of of those cycles. If you're not yet at the implementation or the planning phase, you're still at the collaborative capacity building phase. Awesome. You might be aligned with the technical assistance grants. These are our grants that are up to 1 year and up to $20,000. We say up to because it really does depend on the specific capacity building that your collaborative needs. And more often than not, these technical assistance grants include funding to compensate a consultant or coach that is helping facilitate a collaborative or address the specific capacity building need that your collaborative has. So working with them, you might collaboratively draft a proposed scope of work from that consultant to help meet your specific capacity building need. And if it's a smaller time frame, if it's a smaller scope of work, it might be less than a year, less than $20,000. So you can request what you need for your specific capacity building need. It doesn't have to be all you just backing up to $20,000 and backing into 1 year's. Just like Spark Grant, you have to go through discovery intake process to determine alignment by one of the directors of the technical assistance grants, and then they'll invite you to submit an application. Technical assistance grants do not have to go to our board for approval. We simply have an internal review process. So once a director invites you to submit your proposal and you submit that through our online portal, it kickstarts our internal review process. And as we receive those throughout our fiscal year, and as we have budget capacity, we advance those for our team to consider to fund or not, or maybe provide feedback or ask for follow-up questions as needed. So there is no deadline with this. You can explore the technical assistance grant throughout the fiscal year, and then as you see alignment and with the director, they'll invite you to apply, and we go through a review process, which takes about 2 to 4 weeks. So pretty quick turnaround on this. So that brings us to the end of this virtual information session for the Vitalis Systems Change Grants Program, but more specifically, the Systems Change Grant itself, our 3-year grant of $180,000 that is meant for collaboratives that have built their capacity, they've done their planning, they're ready to implement their systems change now. With that, I'm happy to turn it over to my colleague Michelle to review any questions that may have come up during in the chat room.
Yeah, we had a good amount of questions. So a lot of them I answered, but I will restate for the recording. So the first one is Vitals interested in individual health outcomes or also societal health, social cohesion, neighborhood stability, civic engagement, etc.? And then I answered this in the chat that health outcomes will likely incorporate multiple elements of the healthy community based on social determinants of health. However, we usually ask for you to select a primary, especially in the discovery intake form, to be your focal point, but we know that's going to branch out to other ones. Do you have anything to add, David?
Yeah, I will add, and this is why it'll be important to have a discovery call to kind of flesh out these more specific questions that you have maybe related to your specific project, is systems change more often than not involves upstream interventions, which is more of a community and population health impact rather than an individual community impact. So if you think about the example of food insecurity and hunger, right? The downstream intervention is provide a food bank providing an individual with a food box. That is important because that individual is likely going hungry today. Their family is going hungry today. But the upstream intervention is much more of like, why are people, generally people, going to the food bank in the first place? So what is the root cause of food insecurity? And and how can our systems change approaches and interventions impact the broader population and the broader community? So it really is community driven rather than individual driven. If you want a reference point for this, the visual on the stream, the upstream, showcases that as well.
Thanks, David. The next question you answered, but I'll restate it. You answered during your slides, but can the collaborative partners be from the private sector, C4 ecosystem, or government? Which is yes. Just the lead applicant has to be a 501c3 nonprofit serving Arizona.
Correct. And I will clarify with that since it is brought up. We only fund nonprofit entities, and funding can only be subgranted or subcontracted with C3 entities. So you mentioned C4s. Those cannot be funded with Vitalis grant partnership opportunities.
Just clarification, they can be a grant partner though, right? Like part of their collaborative.
They can be part of the collaborative, but they cannot receive funding. We have funding restrictions to specifically support nonprofit entities. For-profit entities can be included, but not C4s because of the political engagement that they engage in.
And that goes in the next question. The next question is, can the collaborative include 501c4 organizations, electoral politics, and lobby?
It cannot.
And the next one is, can a partner be an individual or do they need to be an organization?
The lead applicant has to be a registered nonprofit entity or fiscally sponsored entity in Arizona, which includes government institutions. It cannot be an individual. This is a really important aspect of it because if you're in a collaborative, you should be really thinking about who your lead applicant is because they should have the capacity to take on the grant and help facilitate that for the collaborative. But if you are one, it can't be an individual or a contractor, for instance, cannot submit on behalf of an applicant. It has to be an organization. Again, a nonprofit, fiscally sponsored, or which includes government institutions, but they can be part of your partnership.
Thank you. And then the next question. Next one was pretty specific, so I'll go to the next. Does Vitalis allow funding of the educational phase of the ballot measures? Work that is not yet referring to a ballot measure, but is critical to the initiative process.
We do not. So that ultimately will lead to kind of if the goal is for eventual ballot measure, that would not be an allowable expense. However, we could still explore as part of our public policy process and then determine if we want to recommend to our board that Violet take a stance on the efforts, even if it's just in the preliminary phase, and then determine at that point if we want to leverage any resources separate from the system change grants program. It would be grants that we non-competitive grants that we might be able to leverage if the effort is aligned with our public policy agenda, but that's a separate process. If you want to explore this, we can ensure that you have the contact information for our colleague Anna Rossetti, who facilitates or who directs our state health advocacy and public policy. So we our exclusion of supporting ballot measures through the Systems Change Grant Program includes that initial research and education that ultimately will, I think, lead to potential ballot measure.
Thanks, David. Um, so I have a couple more questions. The next one I can answer. What is the estimated time it takes to complete each of the applications? Spark Technical and System Change Grant. So I don't have like a good estimated time recorded just yet, but I know technical is going to be the smallest application, Spark being a little bit longer, and System Change being the longest. And I do know people get hung up when it comes to the budget spreadsheet. That's usually their last minute trying to figure that out and get it submitted in time. So I just make sure to give yourself enough time and grace to get everything bundled up and ready before the deadline. And then another question is, what about a C4 applying with a C3 fiscal sponsor? So the recipient is indeed C3. Is that allowable?
The applicant can be a C3 fiscal sponsor, but the funds cannot be diverted to a C4 as part of the effort.
All right, that's all the questions in the chat. I'm not sure if anyone else has questions. They want to come off mute, go on video, or ask more in the chat, but we're available.
Yes, feel free to use the raise hand function via Zoom, or if you do have a question, feel free to simply unmute yourself and ask your question. We do ask that if you have a specific question relating to your project, that is, does this project qualify, that you go through the discovery intake process, and we can determine that more specific details with you then. But for any broad questions, feel free to use the raise hand function or simply unmute yourself and ask live. Right.
I'm wondering how many of the system change grants you usually award per cycle.
Yeah, great to see you, Saber. We have funding this fiscal year currently for 4 system change grants. Historically, we have received anywhere from 40 to 80 initial applications. So that just showcases the competitiveness of the grant process. For Spark Grant, we have 7 to 8 funding for 7 or 8 Spark grants, and then similarly for the technical assistance grants. So that's the total to give you kind of expectation setting for each of our grant types. Very competitive grant process, but again, we really try to drive folks to the discovery process to ensure that we get a high quality pool of initial applicants so that it's just a very robust process for us, and then at that point can decide what additional funding opportunities might exist as we go through that process. But for now, for system change grants, we have 4 funding for 4 grants.
Okay, so a follow-up question. Thank you very much. For the technical assistance that we're allowed to apply for, like a consultant, can they help write the grant? Is that allowed? or does the lead organization have to write the grant?
Nope, you can get help writing the grant in whatever means you can, but they would just the lead applicant should be the organization and not the consultant or the grant writer.
Thank you.
Mhm. Any other questions from the room? Trying to think if there's any other kind of general FAQs that we are often asked. But we really have done our best to try to improve our evaluation rubric, improve this information session to clarify and provide as much upfront so that you can begin to discover if there is alignment. And again, if there is alignment, please go through that discovery process so that you can connect with one of our team members and then and just make sure that your proposal is as strong as possible. But again, as we reviewed in each of the criteria, those bullet points under the or uh, each question for each of the criteria is the exact same question that our reviewers are looking at as part of that evaluation rubric, and that evaluation rubric will be made public and posted and shared as part of the materials. So long as you answer those questions to the best of your ability, the stronger your application will be. Also, if you want more information about the Technical Assistance Grant or the Spark Grant, you can certainly go through the discovery intake process. We also have monthly Vitalist 101 sessions to provide broader information about other Vitalist priorities and then the broader Vitalist grant partnership opportunities. We also hosted a webinar yesterday on August 10th that reviewed the specific criteria around systems change. So that was recorded and will be posted to our website as well. So if you're interested in learning a bit more about the specific criteria around systems change and better determining if your effort is indeed systems change, I highly encourage you to watch that recorded webinar that was just under an hour. So if there are no further questions, happy to call it early. Of course, you can email grants@vitalisthealth.org if you do have any questions, or if you want to discover partnership, just visit vitalisthealth.org, the Partnering with Vitalis webpage, and complete that discovery intake process. Thank you so much for joining us today. I hope everyone has a safe and healthy day. Good luck.